Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back William Lynes. He's a urologist, and today's Kevin MD article is The Decline of the Doctor-Patient Relationship. William, welcome back to the show.
Hey, thank you, Kevin. Thank you for inviting me back.
All right, so tell us what your latest article is about.
Well, I began my medical practice in 1987 and I retired in 2003 and I've been sort of at the sideline with my own health care, but I've been involved in advocacy for physician burnout and physician suicide and have a lot of colleagues. And I've just been concerned about the status of healthcare in the United States. And I think that we see a system which is very bureaucratic,
Hmm.
overburdened. It's influenced by government, by big business, and a lot of other things. But in asking the question of what really is wrong, I come up with really one conclusion. I think that American medicine is the jewel of world healthcare. And I think that you can say that it's based upon a very simple principle, which is that the patient and the doctor make clinical decisions. You use this sort of example of in the exam room.
Hmm.
Of course, it's not always done that way, but basically, that's the basis of it. And what I see is that relationship between the patient and the doctor has been deteriorating. Now, when did that start? Well, it started when I was finishing my practice. I didn't know about it at the time, but as I look back, and again, I retired in 2003, there were some things already that influenced my ability to make clinical decisions. I mean, for example, I think it was around the late 90s or
Hmm.
early 2000s I first became aware of what a physician assistant was. And we had a physician assistant. He offered to do history and physical exams prior to my surgeries. And I thought at the time that was a very efficient thing to do, and I allowed him to do it. But in retrospect, I'm not sure it was the best thing because the history and physical before surgery, at least in my surgical practice, was a very important time of interacting with the patient where I reviewed really for the first time their entire medical history, surgical history. And then you always included with that at the end a very detailed description of what the risks and complications of the surgery
Hmm.
and what the surgery involved with. And what that took away from me, allowing the physician assistant to do it, is that big chunk of time that I spent with the patient. Now, I still was able to do informed consent, talk about surgeries, etc. But it wasn't in the exam room. It was over the phone, or it was at during the pre-op time just before surgery. And really, it was different. There were other things on the horizon at that time. And again, I didn't appreciate them. Things such as physician led committees, which were making decisions about drugs that you could or could not use. And I thought at the time, well, they know a little bit more than me. But in retrospect, I think that also was a mistake. Now, if we fast forward to what it is now, I see that the clinician makes very few of those medical decisions.
Hmm.
I see things like requirements about drugs that you can prescribe. I see things in which pharmacists make decisions about when and how medicines are prescribed. I see committees which decide whether or not a patient can have physical therapy, and on and on and on. And the question is, who's making those decisions? And as
Hmm.
I mentioned, I think that it's bureaucratic situations. And so I think that we're in a bad situation with healthcare in America, and I wish I had hope for it, but I don't know. Time will tell.
So going back to that example where you said that physician assistant would do the pre-procedure history and physical. Now, did you have a choice in that? Was that imposed on you? If you insisted on doing the
Uh-huh.
pre-procedure history and physical yourself, would you have been
Right.
able to do that?
Well, at the time, yes, completely. Again, this would be, let's say, 2000, year 2000. It was between me and the physician assistant at that point. I don't think it is anymore.
Hmm.
Now it's sort of like, well, you schedule surgery and you're booked with a physician assistant, and next time you see him is before the surgery. I think that's the way it goes. Yeah.
So you're saying under the guise of convenience, physicians
Right.
themselves, we've ceded some autonomy, we've ceded some control, and that in effect has harmed some of that doctor-patient relationship.
Well, yes, I think so, and we've seen a lot of it. And I think, and again, it was efficiency. It was because to some extent I was overburdened, and it sounded good at the time. But I think most of the time that we cede the clinical decisions in regards to our patients, it's not a good decision.
So what's the answer here? Because a lot of physicians, we always say that we're burned out with a lot of these bureaucratic requirements, but
Right.
when we outsource that, by definition, we also outsource some of that autonomy as well. So is
Yes.
there a middle ground here?
I think there is a middle ground. I think it's going to be very difficult. I think the only solution is that the practicing physicians need to stand up and say, no, that's not the way it should be done.
Hmm.
The problem is the people who are making those decisions now are very powerful. And they're people and organizations that think that they make better clinical decisions than the physician. I think there's some resentment in there. I think some of these people don't think that physicians make those decisions well. And
Hmm.
so every step of the way, when we're faced with of having that autonomy taken away from us, we need to say, no, we shouldn't do that. And like I said, the people who are opposing are very powerful, and they have money, they have government, they have bureaucracy
Hmm.
behind them. And I think at the root of it is that they believe that they make those clinical decisions better than a physician does.
In fact, you wrote in an article that you think that many of these decision makers have contempt for the physician. Now, have you actually seen that in person, or can you give an example of
Yeah.
what that may look like?
Yeah. For example, the Mayor Giuliani recently was in an auto accident, and if you recall, he got off the
Hmm.
freeway to help someone, and he was hit, and he was in the hospital. Now,
Hmm.
his medical spokesperson was a physician assistant. And she released media out things about him.
Hmm.
And at the end of her article, she says, this is so and so, physician assistant. I am a physician, but I do not operate. And I thought that was an amazing revelation. Now, I'm not saying that they all feel that way. I just think that there is some resentment. I think it's part of the problem.
Now, you call for physicians to claw back control.
Right,
When you instruct physicians to say no to something,
right.
what do you instruct them to say no against specifically?
I think you have to take an individual decision. For example, with just I have shoulder problems. And my primary physician and I agreed that I should have physical therapy. And it literally took two committees to decide that I could have
Hmm.
that. Now, what would my primary physician, do? I really don't know. It's sort of overwhelming. I think that he needed to stand up and say no. That's an obvious thing that he needs. But I'm not sure that he's in a position to do that. Maybe private practice physicians are, maybe people who are in power, administrative physicians are. The clinician, I'm not really sure. It is a difficult problem. I would just mention I haven't been practicing for it's 20 over 20 years now. And
Hmm.
so, I sort of am looking at this from the outside, and it's pretty easy for me to make statements about these things. And the reality of it is I'm not really sure.
So, with all this loss of physician autonomy, the crux of your article is that this is affecting what's happening in the exam room, that
Right.
sacred relationship with doctors and patients. So, speaking
Absolutely.
from a patient perspective, just tell us how some of this autonomy that's being taken away, how does that specifically affect the doctor's relationships with patients?
Well, I'll
Yeah,
tell you one big example
sure.
is the overreach of the DEA and other government agencies on controlled substances. We have a problem with substance abuse in this country. There's no question about it. And one of it is problem is that it's been facilitated by the medical community, but not all of it. I, for example, take a controlled substance every day, and I have been taking it for 30 years. And what I have seen over the last few years is, first of all, the physician can't write more than a 30-day supply. Second of all, they can't write for refills. They have to be evaluated every time. Thirdly, the pharmacy started not allowing you to get your medication far enough ahead of time that you could get them through the mail.
Mm-hmm.
So I started getting it in pharmacy. And then very soon I would go to the pharmacy and they would say, no, you are a day early. Or at one time, I was 12 hours early and I couldn't pick up my prescription. So that's just, if that answers your question, it's just sort of a unbelievable overreach. And really that goes back to the physician-patient relationship, because the way it used to work is Dr. Smith would write a prescription for a 90-day supply or just a 30-day supply of a sedative hypnotic, and they would take it to the pharmacy, no questions, and it would be filled. Now, my point is that there are problems with the original way that that worked. There were more prescriptions written. I did it myself, but there has been a tremendous overreach in trying to fix the problem of substance abuse in the country.
So do you think that the situation is too far gone? Is there any hope to reclaiming some of our
Yes,
autonomy back?
yes. Well, I hope so, because I think that, first of all, we have major problems in healthcare in the United States. It's too expensive. We pay much more per patient than other developed countries, and our clinical results are much less than other developed countries. So I think for once, maybe we look to other models in the world. And so I tend to be a person who looks at the glass half empty, and I'm sort of a negative person. And so I hope that it can be, but the only way it's going to be is for the physician to stand up and say, no, this is wrong, that we need to have physicians making these clinical decisions.
We're talking to William Lynes. He's a urologist, and today's Kevin MD article is The Decline of the Doctor-Patient Relationship. William, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Well, I think I leave with a little hope. I believe that American medicine is a jewel. It is the model of which healthcare in the world has been modeled after. The relationship between the patient and the doctor is the basis of that. And we have a tremendous ability to give out healthcare. And so I think that there is some hope, but I think that we're in a situation that's quite dire at this time.
William, thank you so much for sharing your perspective and insight. Thanks again for coming back on
Hey,
the show.
thank you, Kevin. Talk to you later.